Madan, how are you?
I'm doing great, Jason.
Yeah.
Good to be here.
Great to be in Milwaukee. All of my travels, this is my first time here.
I couldn't believe that. I know you were talking about that.
Yeah.
I mean, how did you miss this lovely town and all those travels?
Never again.
Although we got some humidity here for you,
Yeah,
right? So
yeah.
you got the Arizona sort of vibe going on. But
I get the break from the 115 back there, and
Yeah.
I get 90% or whatever it is humidity here. So,
gotcha.
Yeah.
No, that's good. And yeah, and this is the first time we've ever met in person.
It is.
Right?
It is. All of the conversations we've had, and this is our first time meeting. So
Yeah.
this is great.
This is great.
I'm trying to think about the first. I know that on a previous podcast that I did, you were a guest on there, but I'm trying to think back to the first time we met.
Yeah.
Or the first time we spoke.
Right.
I think you were expanding your enterprise, the Advent enterprise, and you were looking to incorporate oral appliance therapy more. And we had a conversation
Yep.
during the early days of COVID.
Correct. Yeah.
And I was a little embarrassed to tell you, but I was in a rooftop tent somewhere in Nebraska or something,
Got it.
driving around the country, having this conversation with you about oral appliance therapy.
Yeah.
And I was impressed by your advocacy for it as a treatment modality, because I don't hear that a lot from physicians. So that was really impressive. And then I think we just sort of fell out of touch. And then you were on the podcast, and that was an episode that we got a lot of great feedback from listeners.
Okay.
I know that Dr. Aaron Elliott was really impressed by your appliance advocacy and your interest in just all different therapies, right? You know,
Sure.
not having a one size fits none
Yeah.
solution. And then we didn't talk again for a while. I think we might have exchanged some texts or something about music.
Correct. Yeah.
And now we're here. What happened between the music texts and now to bring us here?
I don't know. I think you're going to have to, you were a witness on the ground of something that happened. I guess there was a meeting in Philadelphia. It's been a little bit ago at this point, a few weeks ago, where apparently, what we're doing at Advent touched some nerves, brought up some, question marks, and then we touched base again on the back end of that. And it was really, I don't know. We'll talk about that, I'm sure, at some point. But regardless, I'd say, I think that the repercussions of that situation got us back talking again, and that brought us here.
So here we are.
In Milwaukee, in person,
in Milwaukee
for the first time. So yeah, good. Yeah.
So I mentioned Advent. You mentioned Advent.
Yep.
Can you just talk a little bit about who you are, what Advent is, and why we're talking about this?
Yeah. So Advent, it's a medical practice. So it started as an ENT practice. My wife and I started it back in 2004. General ENT, doing general ENT things, and that's obviously my training. And I think long story short, over the first 10 years of practice, general ENT, particular focus on nose and sinus, focus on sleep apnea in particular. So this is just so people understand the time frame. 2000 and we started in 2004. So 2004 to 2014 was kind of doing my thing. And what really transitioned the practice to being what it is today was me interacting with my patients that I was seeing, and many of whom who had sleep apnea, and all of whom, all is a strong word, but most of whom had suffered wounds from interacting with the healthcare system prior to getting to me. And then, what I ended up being able to do for them was, let's start at the beginning here. Let's make sure your nose and your sinuses are working. And, long story short, we were able to do that in a very simple manner. And then let's make sure your throat is open when you're sleeping at night, and go from there. So, basically, once I understood how broken the healthcare system was in relation to sleep apnea in particular, and airway issues, upper airway issues in particular, I decided to do something about that. And so you could talk is cheap. People talk a lot. Very few people do. And, sort of really about 2014, I decided to do. And sort of the do is Advent. So Advent is a medical practice that focuses on nose and throat issues. We call it the breathing triangle. And
what is the breathing triangle?
It literally, from a concept, it's your two nostrils and the back of your throat. So if you look at those areas and you connect the dots, you create an upside down triangle. That's the breathing triangle.
Okay.
The breathing triangle was my attempt to put construct, a framework around the most important area of the body, and make it understandable to people out in the world, because they don't know. I mean, and I say this often, and I don't think people appreciate how misunderstood sleep apnea, obstructive sleep apnea is as an entity. People know the term. I don't think most people understand that 100% of the time it's coming from the back of the throat. When I say most people, I mean everybody. I mean doctors. I mean dentists. I mean lay people. People don't understand those concepts, and once you break it down and you explain it to them, and then you're able to do something about it, it's a big deal.
Mm-hmm. So when you made that shift, you said that there was this problem, and it was time. There's a lot of talk. There's time for action. Where does that propensity for action come from?
I'm a surgeon. I'm a surgeon, and there's a fork of the road when you go into medicine. Either you basically like to get stuff done, or you like to, I'm trying to be nice to my medical colleagues, non-surgical colleagues. You like to work on abstract problems, it's not so action oriented. So, as a surgeon, the reason I went into surgery is I want to, with my hands, be able to change somebody's life. And that's what I'm used to doing. And so seeing this problem that's sort of sitting in front of me and knowing, and this is another reality with this, is I'm an ENT, an otolaryngologist, so a nose and throat doc. These issues that we're talking about are nose and throat issues. They're not pulmonary issues, and they're not psychiatry issues. They're nose and throat issues. Now, people have sleep issues beyond obstructive sleep apnea, but for people who have obstructive sleep apnea, for people who can't breathe properly, those issues are literally in their nose and throat, and it's not that complicated when you break it down. Basically, you either can get the anatomy more open so they can breathe. If the lining needs to be calm it down, but get things open. And anyway, I think that's the action. The action is everything I do and everything I've ever done is on behalf of the patients who are sitting in front of not just me at this point, but my clinicians. And what we are here to do is to do everything in our power to make sure we are bringing them the lives that they deserve. That's why I'm here. And and that's an unusual mindset. I've come to learn. That's my mindset. I don't know. I've always had that mindset, but various powers that be seem to have different interests in mind as it relates to patients.
What does that mean?
It means that the healthcare system, as it's currently created, is cares about the system more than it cares about individual patients. And the system matters. A patient doesn't matter. You're just a cog in the machine. And at this point, the cogs are people, patients, providers are cogs in that same machine. And there's a tacit, agreement that it's not about finding solutions. It's simply about keeping people moving through the system so that the system is perpetuated. And I'm not a system kind of a guy in that way, meaning when I see something that's broken, whether it's an airway or whether it's a system, my mind cannot help but to think about what can we do to fix it, and that's what I do. And I mean, part of that's just how I'm wired. But part of it's how I'm wired, but the other part of it's an attitude and a mindset.
But a lot of what you're talking about really makes you an outlier in that system.
Yeah, I mean, I think, yes. I mean, at the end of the day, what I've recognized is that what to me seems very innate and natural is, right now you're sitting across the table from me. So if you were my patient, my duty, the reason I'm here on this earth, is to do everything in my power to make sure that you are as optimally functional as whatever your potential is, and if however that's being impacted by the conditions that might be getting in your way, I want to get them out of your way, and I want to do that in the simplest and most effective way possible. That's why that's what I do. I have come to recognize, and it's not a new fact at this point, but the problem with that attitude is very disruptive to the system I just talked about. And, I tend to, how do you say that? The slings and arrows that fall upon me are not new, not unusual, and it comes with the territory. And, what I view is just, this is how I can't imagine a career or a lifestyle, whatever you want to call it, thinking any other way. So I think the way I think, and I'm not going to apologize for it. And because I think the way that I think, that's helped, at this point, thousands of people. And it's also pissed off thousands of people. And I tend to focus on the former, and I acknowledge the latter. But I think at the end of the day, a lot of the people in the latter group are people that are practicing in ways that are antiquated. Let me just sort of make it simple, which when I say that, it sounds like, well, I just threw something out at them. I'm just returning a little bit of friendly fire in that direction, but I simply don't understand. And I won't really tolerate, I think the sort of, we've talked about this a little bit. There's something about me that's, I don't know what you want to call it, that pisses a lot of people off.
Yeah, I think
what
earlier
do you think that
I
is?
said you're an odious character to some. Yeah.
And what is that? What do you think that is?
I think that you're unapologetic, and you're brash and unafraid.
Okay.
So
understood.
There's your bromides for the day, or your insults. You could take it as you will.
No, none of those are insulting. I take pride in all of those things. I mean, I think that's where I'm not. I am who I am. I'm a unique self, and I'm probably the least important thing that we'll talk about. But regardless, I'd say there's a reason why we're here, and a lot of the reason why we're here is because of some of the disruption, if we want to call it that I've been part of.
Yeah, sure. And part of that is, what really brought us here was to talk about Advent's role in providing oral appliance therapy to patients with obstructive sleep apnea, right?
Yeah.
And that's oral appliance therapy is something that's traditionally been in the purview of dentists. And while the American Academy of Otolaryngologists says that it's within the scope of practice for ENTs, for yourself, a lot of dentists, kind of sneer at that.
Right.
So can you just talk to me about sort of how you became aware of dental devices to treat sleep apnea, and then let's start there. I mean, how did you become aware of them initially, and when did you start incorporating them?
Yeah, I mean, I don't remember the specific instance. I believe, I mean,
it's not tattooed in your brain.
It wasn't like the big epiphany, but
eureka.
It was. So basically, just so I'm trying to backtrack, I went through ENT training from '99 to 2003. I don't think oral appliance therapy certainly wasn't anywhere what it was today or even 10 years ago. So sometime between my training and adoption is where I learned about it. But I want to say, I mean, it's got to be more than 10 years. Does that sound right? I mean, honestly, I feel like there's a lot of things I don't know about the oral appliance therapy or dental sleep medicine industry, which we haven't really talked much about you, which you are deeply knowledgeable about, that I think you could educate me on some of this. So I'm going to flip it back your way. I'm happy to kind of take it back again, but I guess you tell me, can we go, maybe let's start in a different direction. Can you give me the timeline, or can you maybe, I'm sure there are probably a lot of people who are listening and watching who have no idea what we're talking about as far as oral appliance therapy. So I guess, can we start there maybe? What is oral appliance therapy? How did you get involved with it?
Sure. So oral appliance therapy is essentially devices worn over both arches, both dental arches, almost like two retainers that are joined together in some way and hold the lower jaw, the mandible, forward to maintain an open airway. And I've been involved in that field for the field of dental sleep medicine for a little under 20 years.
Okay.
Initially, I was a business unit leader at a really large dental laboratory that started fabricating and selling these devices to dentists. And over time, I worked on developing some new oral appliances that are still made to this day and marketed to dentists and I guess ENTs to this day. And later on, I actually left and went to, so that was in a big corporate entity.
Sure.
And later, I left and went to a relative startup that was an EMR for dental sleep practitioners, and grew that business, and then decided it was time to do something different, and left there and started a boutique consulting firm for dental sleep companies. During that time, I was editor-in-chief of a couple different dental sleep journals. But I've been, sort of immersed in that world in a bunch of different verticals, or channels in that same vertical.
I gotcha.
So all over the place.
All over the place. Although, so would you say you were there, relatively speaking, at the inception of dental sleep medicine?
I mean, not at the inception, but certainly the trajectory, the growth trajectory. I was there when that really started to rocket.
Gotcha. And there was no controversy whatsoever at that point in time. Everybody accepted the fact that dentists are going to be in this space. That's not true, correct? There was controversy. I'm sure there was some uphill battles that had to be undertaken back in the day.
Certainly. I mean, there's always been, it's an emerging market, right? So there's everything is a challenge, right?
Yeah.
Creating awareness. I mean, you sort of touched on that earlier about OSA in general, where physicians don't realize how crucial it is to address the issue.
Yeah.
Dentists don't know about it, and patients don't know about it. So, you talked about the breathing triangle. I often talk about this sort of Venn diagram where, the overlap would be a lack of awareness between physicians, dentists, and the public.
Well, and so I'm aware, and so our listeners are aware too. Why was there a need for an alternative therapy? Why did dental sleep medicine come to be to begin with?
Well, the most common treatment modality is CPAP or is PAP, right?
Okay.
And the literature supports that it works. It works really well, but compliance is really low.
Yeah.
So you've got this very effective treatment with very low compliance. So how effective is it really? Oral appliances, on the other hand, are typically not as, for the majority of patients, are not as effective at lowering AHI. But compliance is very high, depending on what study you're looking at. It's somewhere between 80 and 90%, which is more than double of what you see with PAP. Yeah. So that's really where oral appliance therapy has become more widely accepted. But there's still a lot of work to do, as you're aware. I mean, adoption is low. When you look at oral appliance therapy, where the numbers are abysmal when you look at that compared to the PAP prescription habits of physicians.
And just so people are aware, so abysmal, like the numbers I have in my head is that I believe for obstructive sleep apnea, the percentage of folks who are using oral appliance therapy is like 5 or 6% of treated individuals. Does that sound right to you? Or
that sounds high.
That's high. So it would be it's single digits. We can agree that maybe it's single digits. It's either whatever. Let's call it low single digits. And 20, 25 years, however long that oral appliance therapy has been going, would you consider that a success?
Of course not.
Okay.
Yeah.
And it's the journey's not done, correct?
Sure.
But and again, just so people are aware, my understanding is, and there are other countries like the Scandinavian countries where there's a little bit more of a clear pathway for individuals to get diagnosed with sleep apnea and make a choice between oral appliance therapy and CPAP. And in those countries, I believe what I've heard is it's more like 50-50.
Sure.
Does that sound about right to you? Or?
Yeah, I don't know about the exact stats, but yeah, it's certainly those are the trends. But to your point earlier, the system here is broken.
Yeah.
Right.
Right.
And there are a lot of interests, corporate interests that influence those prescribing behaviors.
Right.
That inhibit information, and there's a lot of for the sake of this conversation, I'll just call them turf wars, right?
Sure.
There's these sort of fortress mentalities. And frequently, what I've heard and what I've seen from a lot of dentists is while they understand and embrace the importance of having a referral or relationship with a physician, they oftentimes complain that here, I'll paraphrase, right?
Sure.
So this is I'll call him Dr. Dumas, Dumas.
Okay. Yeah.
So Dr. Dumas says, "Gosh, all these patients hate their CPAPs.
Yeah.
But every physician just puts patients on CPAP. That's it.
Mm-hmm.
That's it." And the physician, we can call him Dr. whatever, Dr. Physician.
Yeah.
Dr. Physician says, every patient, these dentists, they don't take good care of the patients. They slap them in one of these oral appliances. They charge them $6,000. They don't take insurance. They don't follow up with them. Mm-hmm. And my patient's miffed.
Yeah.
Right?
Right.
And so you've got these two polar opposites, right? These binaries.
Yeah.
And the truth is neither one of those.
Mm-hmm. Right.
Is that accurate?
Yeah. No, I think that's accurate.
So how has that happened, and how do you bridge that gap?
You don't.
You just burn it. You burn that bridge.
You create basically, human beings are very interesting creatures. We are, and we're very tribal. And when you get tribes that are separated and created, and now you want to kind of, do the kumbaya and we're going to come together and everything's going to be fine, it isn't. You could bring the peace, you could do whatever you want to do to make that happen, but there are, what you described are stereotypes about both, we'll call them parties. And in my opinion, and maybe it's not true, but I believe that there are kernel truths that are buried within most stereotypes.
Okay, so let's start with the physician one, because you could probably speak most to that one.
Right. Yeah. So let's sort of state that with clarity. I'll just restate, I think, what you said, which physicians have a one-track mind when it comes to sleep apnea. Well, a couple of things. Physicians as a whole.
Here, I'll say it clearly.
Okay.
Physicians put everyone in a CPAP, mm-hmm. and they disparage oral appliance therapy. They say that dentists, it's not covered by insurance. Dentists charge the patient an exorbitant amount of cash, and they don't work that well anyway. How about that?
Fair, although then I'll go one step up the ladder. I would say 99.9% of physicians.
Wait a minute, you're going to one-up me on this?
On this one, yeah, because I'll go 99.9% of physicians, and I'll say 99.9% of dentists have very little understanding or regard for sleep apnea to begin with. They hear about it, but it's a problem they don't know what to do with. So I think the ones that, to kind of go back to where you were going, I'd say, what percentage of physicians know that oral appliance therapy exists as a treatment for obstructive sleep apnea? All physicians.
Pause there.
Yeah.
What percentage of physicians even know that obstructive sleep apnea is really a problem, can identify the signs and symptoms, and have an idea about where to go from there?
That's my 99.9 do not. So, I think we're sort of saying the same things coming from a different angle, but basically what I'm saying is that, we're in rare air when we're talking about physicians who know what sleep apnea is, really know, have any regard for sleep apnea, really have a regard, and are now thinking about treatment options and are actually putting people into treatment. That's a very small sample. So if we want to go to all physicians, and why I'm going to all physicians is because all physicians and all dentists are the ones who are in front of all patients. And so if you want to understand why the system's so screwed up, then you understand the fact that most patients are never going to sit in front of they're never going to sit in front of a clinician who has any regard for these issues whatsoever. Mm-hmm. So if you don't start there, which is sort of the place I try to start, you're not going to do anything. You're really, at the end of the day, you know, this is where it's so pathetic in my mind, is these turf wars between the CPAP evangelists and the oral appliance therapy evangelists, and let's throw the Inspire evangelists in there for good measure. You know, you guys are having turf wars over a skinny sliver of pie that at the end of the day isn't even approaching any semblance of reaching the population.
Yes.
And I think that I think if I said that to any of those camps, I think they'd all agree. Yet then they'd all look over at me and they say, "Yep," and then they turn at each other and then they throw the pitchforks out, right? Yeah. So you know, but let me just. So I guess I just want to sort of start on high, and I'd say, no, I think I know that to be true. And that was one of the things that pissed me off back in the day when I was seeing patients. And, you know, the world's changed a bit since, you know, sort of I kind of got an epiphany on this, but it hasn't changed that much. And in fact, let me just go this way. You know, at Advent, we haven't really talked about Advent a ton, but, you know, we are a direct-to-consumer practice, so we try to increase awareness to treat breathing triangle issues, the nose and throat issues. And, you know, we've got, 17 clinics. We're in 4 states, so, you know, yay for us. But we haven't even, like, we haven't, in the grand scheme of things, actually done anything that needs to be done. Meaning that, you know, just so people understand the gravity of this situation, 20-30% of the adult population in this country has obstructive sleep apnea. 80% of those individuals never get diagnosed. The 20% that do get diagnosed, most of them try and fail with CPAP. Most of them, pretty, when I say most, I mean like 100% of those folks have never heard of oral appliance therapy. So it's not even on their radar screen. So this is the measures of success that we're looking at, and it's pathetic. You know, then you look at what we're trying to do, and we're trying to increase awareness. We're trying to increase awareness for all treatment options, but we're also trying to increase awareness for the fact that these issues exist, they matter, and people's lives are, you know, irreparably damaged. People die from these issues. And, you know, while a statistic for the system, and the system doesn't actually care for that, you know, they don't care about those individuals. I do. And I believe that, you know, my dental sleep medicine colleagues do. And I believe that those sleep medicine docs that are putting everybody in CPAP, I'm not sure that they do, because that's such a, you know, when you're throwing something at somebody that has such a low adoption rate, but I'm going to give them the credit right now to say, I think they care too. But unfortunately, the small amount of individuals who care about this many of them care a lot, although in the grand scheme of things, we still haven't moved the ball at all on this. Right. So anyway, I guess I don't want to be nihilistic, but I am realistic. And at the end of the day, I think, I kind of skirted around what you asked me. I'd say, we talked about stereotypes between physicians, and it's a CPAP or, you know, CPAP. And that's true. I mean, I think it's infuriating, but it's true. Why is that? Let me just kind of why do you think that, you know, we'll just say sleep medicine doctors, why do you think that's the only option for them?
Probably because they've been inculcated with that education, with that information. Mm-hmm. That's what they know. That's what they've done. And anything that's counter to that is a disruption to, you know, in some ways, their beliefs.
Yeah, gotcha.
And as a result of that, most people don't want to open their eyes to it. And I would say that same thing is probably true for dentists and oral appliance therapy. You know, this is the hammer that I have.
Yeah.
So it's the only damn hammer there is.
Gotcha. And do you think it's so basically, I guess what you're saying is you think it's a culture, a education. This is how somebody's wired, kind of a thing. Is there usually when I see a problem that's for which is a solution, I don't know if that's proper grammar, doesn't seem to make sense. If it doesn't make sense from a pure logic standpoint, then I go follow the money. And is there a follow the money thing here or not?
You tell me.
I think it's enticing to think that there is, but the reality, meaning that, hey, if I was uninitiated and I'd say, geez, there's this thing called sleep apnea. Like when I started in training, people didn't know what sleep apnea was, and then all of a sudden everybody had it. So let me just go to a slightly different direction. So there's a kind of the buzz on the street that this is like a made up kind of a thing, that there's some sort of, somebody's gaming the system, that they've invented this thing that everybody now has. And now they've got this treatment they're going to throw on you. But let me just kind of fast forward through the ages. Then I'd say, do sleep medicine doctors get monetary reimbursement for putting people into CPAP machines? What's your answer?
The answer is yes.
My answer is not in the way that I think you think, or most people think that. I mean, the reimbursement that most physicians in this country at this point are employed by hospital systems and other entities. And there are various laws and things in place. And so I actually, the reimbursement that a sleep medicine doctor gets for putting somebody into CPAP is simply the visit fees for you to come in. But there's not really currently, I mean, there's things in the works as far as remote patient monitoring, so forth and so on. But as far as what's really happening today, there's not really a monetary factor as much as you, in my mind, I'm like, I always thought that was, but I actually don't think there is.
So then what is it? Then why the emphasis on it?
I think it is more about, I kind of led you in a blind alley purposefully, sorry, but meaning the whole money thing, because it seems very like, oh, it's got to be, but it really isn't now, but I think it really is, it's what they know. And then it's like, well, what else? What else is?
I'm giving a little more credence to your colleagues by saying that I think it's because it's their behavior, their habit. It's what they know. Yeah. Because while I think follow the money, I think they think that there's an aspect of that. I think it's really more about just, this is what I do. This is what I've always done. This is what I learned.
Sure.
And you see it a lot. I'm going to take us in a slightly different direction, but with dentists and oral appliance therapy, a dentist goes to a course. They, sort of a dental sleep 101. They learn about whatever company hosted that course.
Yep.
They learn about that device.
Yeah.
And they probably go to another course by that same device manufacturer.
Yeah.
And they become zealous about that device.
Sure.
So any other device manufacturer that says, well, our product does this differently, this better, we have a faster turnaround time, it's more durable, whatever it is.
Yeah.
It's like, how don't you dare cast aspersions at my device of choice, right?
Sure.
It's almost a religious affinity for it.
Yeah.
And I think that the same thing happens with a lot of physicians in PAP.
Yeah.
But we've all got to open our eyes.
Yeah.
Right.
Although it's hard to.
There is no panacea.
There is no panacea. Although when you're talking, what you're talking about, I was thinking, what animal is that, Jason? It's a sheep.
That's a sheep.
That's a sheep. So what you were just when you were describing what you were just describing, I was actually thinking about, what do most sheep do? Where does a sheep like to be?
In the pasture
with their herd,
with other sheep,
with their head down,
yeah.
And sometimes just sort of minding their thing. So I mean, to me, when I talked about tribes, and as you're describing what you're describing to me,
talking about herd mentality.
Herd mentality. I'm in the pack. I'm safe here. I'm completely incapable of any effective action because I'm a sheep. But I'm here with my buddies, and I think I think there is that tribal aspect. And so both ways.
That is where I think both of us, right? We're kindred spirits in a sense. in that neither of us are sheep.
Yeah.
Right? We tend to walk to the beat of our own drum. We don't mind upsetting the herd and going in our own direction. And we're oftentimes out of step.
Yeah.
And with that said, earlier you mentioned that there was no way to sort of join hands and say kumbaya.
Right.
And I want to say, let's give it a try. Madan,
All right, here we go.
on 3. 1, 2, 3.
Kumbaya.
Kumbaya.
There we go.
For a real meaningful shift to happen, I mean, it's got to be a tectonic shift to alter the landscape. That's probably happening, but it's slow